The first. The first of its kind, cold ablative fiber laser solution. The first device to give new life to all skin types. Finally, a way to treat every single patient. UltraClear, the first safe solution for sensitive skin, especially skin of color. Optimized to individual needs, balancing cold and thermal energy at the optimal wavelength. Ablative resurfacing and 3D collagen remodeling in one pass, delivering each pulse to the exact depth with precise timing, minimizing risk and pain, allowing faster healing with optimal results, keeping patients safe from discomfort and side effects, something they can count on every time, no matter what. Letting them get back to their day quickly and making sure they feel amazing when they leave. Be the first and move your practice forward. UltraClear, the clear choice to reverse the signs of aging for all skin types.
I don't know about you guys, but that had me paused. And I'm sure as you guys see kind of what this laser can do, we're actually going to do a live treatment and demo on me so I can show you guys kind of all the benefits of it, how it actually looks as you're getting the treatment done, and how painless it is too. So one of the best parts about this laser is the fact that everybody is a candidate. Meaning in the DMV, what I love most about being in practice here is that we see people of all different age groups, races, skin types, and skin concerns, whether that's tone and textural issues, or it's hyperpigmentation, melasma, rosacea, acne scars, surgical scars, and the fact that you can treat the whole body. It really kind of does something for everybody. And I think that's super important. Unlike a lot of the other lasers, which you can only do during the fall, winter time, or you can only treat on the lightest skin types, this gives us that versatility and real results too. And so one of the main reasons why patients choose this treatment is the fact that it's really comfortable. So recovery is really, really short. And that's really due to the way we can scale down how much heat is generated into the skin. So in some treatments, when we're really trying to aggressively resurface the skin, we might want to turn the coagulation up to maximize kind of the skin tightening effect. In other people, when you turn it all the way down, you get less inflammation in the skin, so you get a quicker and safer recovery. And the fact that you're not going to stimulate more pigmentation, or you're not going to stimulate worsening of melasma or and things like that. It really just gives people a faster turnaround time. That's about half of what traditional CO2 lasers and that kind of those kinds of treatments can give, while still having the same exact results and benefits. The fact that people can come in for a treatment, and we're going to treat my forehead and upper face today, and you can literally come in for 15 minutes on your lunch break and go back to work with a little bit of redness and little dots on your forehead. It's really, really easy to get back into your normal life. And the fact that you can treat the whole body. So you can treat the hands, you can treat the neck, you can treat the chest, you can treat your knees. I mean, literally there's no body part that you can't treat, versus some of the resurfacing lasers and things that are out there where you're really confined to the face alone. And if you did the neck or you did the rest of the body, you'd have to really, really dial down the settings so that you're staying safe. So this gives us kind of an all-in-one solution. And so this slide shows all the different skin types, the kind of rainbow that we see, and you can find which skin type are you. I'm personally about a type 5. That means I almost never burn. I think one trip I can remember a little bit of soreness to the shoulders, but that's really it. But if I spend any amount of time outside, I always tan. And what traditional lasers can treat is really skin types 1, 2, some 3s, and then really skin types 4, 5, and 6 there weren't really any options out there as far as lasers go. In fact, people with skin of color, my skin type included or darker, were kind of afraid because we hear about horror stories of somebody that went and got laser hair removal and got burned, or had a resurfacing type of treatment and had worsening hyperpigmentation, or even worse, hypopigmentation, where you lose all pigment. And so the fact that we can treat all skin types has been huge. There are three main levels of treatment. One is the superficial. This is the 3D Miracle or clear mode. This is for all skin types. This really gives people that skin glow after it, improves texture, pore size, and is really the best treatment for pigmentation and sun damage, so any hyperpigmentation of the skin. We can go deeper, and the deeper you go or the more aggressive you go, you increase the downtime by a slight amount. It's really 3 to 5 days of more like social downtime than anything. But after 48 hours, you can put on tinted sunscreen. You can even put on makeup after 48 hours if you have any residual redness. And this mode is Clear Plus, which goes actually deeper into that top layer of skin. There's Ultra mode, which we'll go over, which really stimulates that collagen synthesis. And then UltraClear, which is that deep and the superficial as a combination treatment. And even some of our more advanced treatments like laser coring, which give an even more skin tightening effect, those are treatments that still can be done on all skin types that have a slightly longer downtime, but nowhere near the level of the 6 weeks post CO2 laser that our industry really was used to. And so these are the three layers. So quick biology lesson. So we've got layers to the skin, almost kind of like a ham and cheese sandwich. So you got that top layer of bread. That's the very top layer of the epidermis, or called the stratus corneum. That is what is addressed with 3D Miracle. So we have this layer of basically dead skin on top, which gives our skin kind of dullness. It clogs the pores. And by kind of ablating that and resurfacing that skin, we get a really nice, healthy glow. As we go deeper down through the epidermis, maybe that layer of ham, in that ham and cheese sandwich, you're starting to get into more collagen building. You're also really lifting up the pigmented cells. And then as you go into the dermis, where that cheese is, that's kind of where you get more skin tightening effect, more collagen production. That's where we're using some of the Ultra mode to clear up acne scars and wrinkles and fine lines. And so some of the history of this laser, so CO2 laser, which has become more of a household name, it's a really deep, excellent resurfacing laser. It's been around for 35 plus years. It came about in the early 90s. That was kind of the mainstay. And it was one of those things that, like, it was great for the South Beach in Miami, like extensive sun damage. You can hide away for 6 weeks and not really see anybody or do anything, and kind of look like a burn victim for a while. And so it was kind of the only treatment out there. And so people would have to go under anesthesia because of how painful it was, and then really hide out for an extended period of time. And again, that was only confined to kind of the lightest skin tones. And so the whole industry in general has been kind of moving towards having treatment options that are more versatile, that can be treated on all skin types. And so in 2018, Aclaro, the founders of UltraClear, came out. It kind of was the first big innovation in laser resurfacing technology. There were small little things where people were using erbium lasers and other things, but they still were limited due to the long downtime and kind of the inability to treat all skin types, or treat them without caution. And so this really launched in April 2022. And it's kind of cleared for everything: fine lines, wrinkles, age spots, scar revisions, benign pigmented lesions, vascular dyschromia, meaning red, is even being effectively treated, as far as like rosacea, and just generalized redness of the skin, also being treated with this laser, which is super exciting. So one of the main reasons why there's less discomfort and less downtime, I mentioned it earlier, but was that lack of heat, or our ability to turn down the heat. So we're really truly giving a cold fiber laser. And where that comes in is with the heat production. If you're introducing a ton of heat into the skin, that's where you get the inflammation, you get the ton of swelling in response to kind of that really hard vaporization of the water in your skin. You end up damaging kind of the surrounding structures. And so what this does, I'm going to show you a quick little video of this. There's these four little pulses that go down. Even at the deepest of treatments, you're able to get down there by doing a little bit of heat and then letting it cool down, and then doing a little bit of heat in that same hole and letting it cool down and going down deeper. So you can go down even beyond the epidermis into that deeper dermal layer and get that real collagen production without generating all that heat to the surrounding tissue and getting less swelling and less downtime. The other thing is that each little micropulse is so much faster than what the traditional CO2 lasers and the traditional erbium lasers could do. And so it's really fast. And so we'll see it today. It's literally one beep, you'll hear boop, and that whole like row of treatment will be done on my skin almost in an instant. And the longer, or I guess the shorter the treatments are, the less pain the patient experiences. And so I'm a big baby. You'll see that I'll be able to handle this treatment with literally no numbing cream. We're going to clean me off and just do the treatment right away without having kind of a lot of downtime. I'm going to go golfing this weekend, and it's super easy and quick. All right. And so let me show you kind of what a treatment looks like. You guys are going to see it on me as well. But essentially, we can customize it to your exact skin treatment. And so in my case, I have some post-inflammatory hyperpigmentation, so little dark spots that show up post-acne that hang around forever. And so what we're going to do in my case is we're going to go over those spots directly with a small spot size to get a little bit the deepest aspect of the treatment right in there. And then we're going to do an overall treatment just to help with fine lines, that collagen production, kind of give an overall glow. I'm going to show you some before and afters of different patients who have gotten these various treatments. And one thing that I want you to kind of pay attention to is kind of the glow. In general, people are wearing less and less makeup these days, or wanting to kind of be able to go out there and feel confident without any makeup or anything on their skin other than maybe some tinted sunscreen. And this really kind of gives like a Instagram filter for your face at all times. And really helps with the skin quality. And as far as like an anti-aging type of treatment, there's nothing really that I can think of that's better than this. And this is a patient experience and recovery.
So 2 months ago, I had my first treatment, absolutely no pain, no recovery time. I was a little reddish pink, maybe for a day. And that was it. And the results were great. And this time, 2 passes, absolutely no pain. I can't wait to see what's next.
Literally, you'll have maybe an hour, maybe 2 hours of like feeling like you had a sunburn to the skin, and then it cools off immediately, and then you feel like you have nothing at all. Like it's as if your skin is just back to normal. So I tell my patients right now that are getting the treatment, the AC in the car on your car ride home is probably going to be your best friend. And by the time you're home, pretty much your skin is cooled off and you don't really need to do anything else at that point.
So 2 months ago, I had my first treatment.
All right, let me show you some pictures. This is where the fun really begins. So this first set, these are superficial pictures. So these are meaning the 3D miracle, kind of that halo glow all over, really targeting kind of the pigment, the pores, and the overall skin quality. And so this is with just one treatment, again, minimal downtime, just showing the improvement in the overall skin tone, the variation in skin tone on the left with all the hyperpigmentation, all the sun damage. Even in one treatment, you're really wiping it away to a large degree. And a lot of times it's like, is that like a skin lightening treatment? No, it's not. There was actually so much sun damage from it that you're really being able to kind of start with a clean slate. Same thing here. If you want to notice kind of how glowy her skin is starting to look, this main area of hyperpigmentation that this patient's been dealing with for a long time is considerably lighter, just overall looking so much better. Younger patients can benefit from it too. Just the glow to her skin, the pore size is really minimized. Some of her hyperpigmentation is also improved. And this is an excellent example of that glow, just of her cheeks. This is with no makeup, and showing that all skin types can be treated with this laser, especially with a 3D miracle with minimal downtime and be able to kind of get back to their lives. You can treat the neck, sun damage the same way that you can treat the face. I mean, you can treat the back of the hands, you can treat the chest, and really kind of improve all the areas, especially the back of the hands. That tends to be a giveaway. We do a great job kind of wearing sunscreen and protecting our face, but we kind of neglect the neck and the hands as well, and can be dead giveaways. But what's kind of even more exciting than the kind of superficial treatments are when we go a little bit deeper. Again, still with like 3 to 5 days of kind of downtime, but you can really get some impressive results. And so this is still with that clear superficial mode. This is 5 days post one treatment, just showing a big improvement in her overall skin tone. A lot of that hyperpigmentation has improved, and her skin just looks more even toned and healthier. Love this before and after here. So this is 6 weeks post one treatment. This is again that clear mode, taking that top layer of bread off, and getting that to heal over. And then on the right side is 4 months after a second treatment, just showing the improvement in this big area. And you could try doing topicals on this area for months and even years without getting kind of this disruption in pigmentation. And instead, you can do something that's effective, even with one treatment showing a huge benefit, but then with multiple treatments really getting rid of it, almost starting from scratch as far as your facial kind of rejuvenation looking like. Again, showing kind of stubborn pigment and melasma improvement with this treatment. This is 10 months post 2 treatments, showing that there wasn't the heat production in the skin causing kind of rebound melasma or worsening of melasma, which is something that happens with IPL, pulse dye laser, CO2 laser, or other treatments out there. This shows the improvement in redness too. So after surgery, after people have body surgery or even facial surgery, they can get a little bit of pinkness to the skin. And so you can even treat that and get improvement in this scar quality afterwards. And you can treat that again anywhere on the body. The under eyes. So the under eye skin is insanely thin, even compared to the adjacent cheek skin. And so this drives people crazy, is the crepiness of that skin, the wrinkles under there. Eye creams don't work for the most part. And so really finding a solution that we can safely treat that under eyes. I can treat all the way up until the eyelashes, basically. And you can get some really nice skin tightening. This is 5 weeks post one treatment. So this is not swelling that's present in the skin at that point. Really trying to kind of smooth that skin over. This is an impressive before and after here. Really smoothing that area out and making it look so much better. And this is 1 month post one treatment, which is exciting. And then you can customize it. You can mix and match some of the deeper modes in some areas or some problem areas, and then kind of do the more superficial treatments for areas that have more hyperpigmentation or redness. So this person had some redness, some red acne scars on her chin and across her nose, and just has this kind of overall glow to her skin. Same type of deal, showing that kind of brightness improvement in the skin, the hyperpigmentation going away, treating reds, browns, and everything in between. Acne scars, which drive people crazy, and I'm not talking about the brown discoloration of the skin or red discoloration that can happen, but the depressed acne scars. There aren't really too many treatments out there where you can get that collagen building from within, and to get them to smooth out. This person had been dealing with these long-standing acne scars in her cheeks, And even after one treatment, showing her 3 weeks later, she shows tremendous improvement. Same thing here, showing like a Fitzpatrick 3-4. Doing an ultra treatment, you can get a really nice improvement in her cheek acne scars as well. The last thing is skin tightening and improvement from that standpoint. We've all been searching for things that can tighten the skin. You want to think about the facial and neck skin just in general as kind of this inflationary thing. So it's actually inflating as we age. Meanwhile, our skeleton, which is kind of holding up and supporting everything in the past, is actually shrinking, kind of like osteoporosis, that the bones actually become smaller. And so we get this skin laxity. And even though I perform facelifts and neck lifts, and that's kind of my specialty, this gives us a nice option for people that maybe aren't quite ready for surgery, or they know that they're never going to be ready for surgery, but they do want to see some skin improvement, some skin tightening effect. And literally through those little channels that we create with ultra mode or with laser coring, which we'll talk about at our next webinar, little teaser, we can get a skin tightening effect from the collagen deposition, but also by ablating and actually reducing the overall surface area of that balloon. And this slide kind of showing that same skin tightening effect, looking at her jowl area, just showing kind of the reduction in fine lines and the tightness that she's kind of achieved, in addition to treating some of the hyperpigmentation and kind of dyschromia that she has and sun damage. And then finally showing another really impressive kind of skin tightening effect along the jawline. Is it a replacement for surgery? No, but what's really exciting for me is when I'm pairing these types of treatments post-surgery or during surgery, so that people are really kind of wiping the slate clean, getting a really excellent surgical result, but then really taking it to the next level with the laser skin resurfacing. And her skin just looks so much brighter and more glowy. And then this slide I included just because if this young chap could tolerate his UltraClear treatments, I'm sure you can, and I'm sure I can. I got Botox yesterday and literally had to have 2 people holding my hands just because I'm a big baby when getting these treatments. But literally, you can do it with no numbing cream and still be fine. And again, he can handle it at whatever 5 years old. So showing you kind of the progression of what healing looks like. So the before picture is on the left. The middle picture shows 4 days post one treatment with UltraClear. And so like she's maybe has some mild, very, very mild facial swelling. If anything, she has maybe a little bit of pinkness to the skin, but really not looking bad at all. And then the picture on the right showing 7 days post her second treatment. So really by a week, people are completely back to it without really much residual healing whatsoever. And they can, again, wear makeup on and tinted sunscreen starting at 48 hours, which is incredible even for the deeper treatments that we do. And so what I'm really, really excited about is sharing our Korean Glow package. So for those of you that don't know, Korea is actually kind of the plastic surgery capital of the world. And one of the things and one of the concepts that we took from them was the fact that people would go to these clinics and these med spas where they're not necessarily doing like an a la carte, oh, I'm going to do this one treatment one time, hopefully I see some results, and then I'm going to try something else. It's kind of a comprehensive package that's put together, and they go from room to room or floor to floor where they're getting different treatments that synergistically kind of add up to more than the individual parts. So it's like a 1 + 1 = 3 effect. And so we have a Korean Glow package, which is a combination, and I'm going to tell you about each of these. Includes an IV treatment of Niagen, which is a really exciting anti-aging compound. We do professional grade LED red light therapy and infrared light therapy that's great for anti-aging during the numbing process. Then we do a moderate UltraClear treatment. Again, we're targeting fine lines, wrinkles, acne scars, hyperpigmentation, literally everything all at once. And then we introduce something called PDGF, which is platelet-derived growth factor. And that actually has growth factor that's up to 300,000 times more concentrated than your own blood, which actually speeds up your healing process, gives you an even enhanced result even further. So it's kind of a 2 weeks, let's do an aggressive treatment, and literally you can get incredible results. This is one of our anesthesia providers, and this is her 2 weeks afterwards. And just the extent of sun damage that she had, it literally looks like she got fresh Botox because of how clear and glowy her skin is in 2 weeks. And so to tell you a little bit about Niagen, so this is that IV infusion. And so the infusion, there's a big kind of interest in how do we age, or how do we age more gracefully from the inside and out. And so there's this interest in biohacking, and one of the biggest compounds is something called NAD. And so if you guys go way back to your kind of high school biology class, NAD is responsible for the ATP production, the powerhouse that fuels all our cells in our entire bodies, our neurons in our brain, our cardiac cells, our musculoskeletal system. It powers everything. And so NAD is a form of vitamin B3, and we literally use it for the energy of our entire bodies. What's the problem with it is that our store of NAD in our whole body actually decreases up to 65% as we age. So between the ages of 30 and 70, you actually lose more than half of it. And it's not just age, it's actually kind of your environment too. So whether it's you're overtraining, or you're not exercising at all, or you have excess sun exposure, alcohol use, you're a smoker, you vape, like all those things kind of lead to a depletion of this NAD. And so what you can do is we do an infusion. Since we're doing a moderate UltraClear treatment, we want you to stay comfortable. So we put a bunch of numbing cream on, and while you're doing that, we have the infusion going. People can experience a lot more energy, better sleep. It's literally fueling your system from within. And because you're tanking up your body, you're kind of primed, no pun intended, to actually heal faster and get a better result. And so while that's going on, and while that infusion's going on, we do our professional grade red light therapy. Traditional at-home ones maybe have 60 or up to 100 LED lights. This one has 1,400, so we're really kind of stimulating that collagen production, increasing blood flow to the skin in order to maximize that glow. We already talked about doing the moderate UltraClear treatment, but then following it, we'll put topically on this platelet-derived growth factor that really speeds up that healing process. There's no blood draw needed. It's completely synthetically made growth factors that we put on top of the skin in order to heal. So it's not derived from another human, not derived from an animal or a plant like certain exosomes and stem cell therapies and things are. This is purely synthetic, just like how they make insulin for diabetic patients, and we put it topically on the skin because we've created those little micro channels so that we can really absorb that PDGF and get the best benefit. All right, Holly.
Awesome. That was absolutely fantastic. Thank you so much. So now we want to kind of give you guys a little bit of an idea of what our promotions are for today. So you have to be quick to book. So in a moment, I will pop our phone number into the chat, and you guys can either call or text to claim your spot. So 5 people who book, the first 5 will receive 20% off of our 3D Miracle package of 3, plus 20 units of complimentary Daxify. And then also, if you guys are interested in that amazing Korean Glow package that we just talked about, we're offering $1,000 off as well to the first 5 who book. So I will pop that in the chat here while we get ready for a live demo.
Do you mind if I say that just in case the Instagram Live couldn't
Yes,
hear
absolutely.
it? Yeah, so you can call or text our phone number, which is 301-302-7272. We've got 2 different offers that we're doing and promotions because we're super excited about this laser, and I think literally everybody should get it. But we're doing 3 of the 3D Miracle treatments. So normally they're $800 a piece, so 3 of them would cost $2,400. But we're packaging them together so that you can get them for 20% off. And then we're throwing in 20 units of Daxify, which is like the newest form of Botox, so that you can kind of get the best results of both. And so you're treating kind of the dynamic wrinkles. Maybe you want to treat kind of the 11s or some of the forehead lines. You're treating those, but then you're also resurfacing the skin and rebuilding that collagen, and getting the best response. And then the final is $1,000 off that Korean Glow package, which I'm super excited to put everything together and kind of get that glow and that full reset of your skin.
Awesome. Are we ready for our live demo?
Yes, let's do our live demo.
Fantastic.
So if you guys have, I'm going to kind of like talk through this treatment. I'm going to take off my white coat here, but if you guys have questions about it, we're going to try to get up close with the phone so you can kind of see on Instagram kind of what this looks like. But literally, I'm going to do it right here in this chair. So first thing, I'm going to introduce you to Veronica. She's our wonderful nurse here at Prime. Do you want to say hi?
Hi, everyone.
So she's going to start by just cleaning off my skin. And so we're just going to treat kind of my forehead, and we're going to do some spots on my cheeks as well. So this is just a little bit of alcohol. And again, I've had no numbing cream whatsoever, nothing. Just cleaning off kind of the sunscreen that I have. And then we're just going to put on these little eye protection glasses. Just to stay safe. Thank you very much. Right. Are you ready, Veronica? Almost there. So what we're going to start with is we wanted to treat, me and Veronica were talking about a game plan kind of before this call. And so we wanted to treat kind of my hyperpigmentation that's really stubborn, and treat that with one pass of the 3D Miracle here first. And then we're going to do a 3D Miracle treatment on top of all of our skin on the forehead.
Right.
Mm-hmm.
Great.
We can turn that. That smoke evacuator. Here, I want them to hear kind of what the treatment actually sounds like as each pulse is done. That's it. So each little beat, you're hearing kind of it go through that top layer. And so she's treating some of the hyperpigmentation on my temples and forehead. Sure thing. Very nice. It just feels like, I mean, literally the lightest, I wouldn't even call it like a rubber band snap. Compared to kind of like the Botox treatment I got yesterday, significantly less discomfort. Okay. So now Veronica's going to switch to kind of our bigger spot size. So you're going to see the little tiny rings everywhere. And this is that 3D Miracle treatment. Let's tighten this up. And so even with these larger kind of spot sizes where we're treating kind of a 15mm area, really is really quick. And so it really minimizes kind of the discomfort. And I literally had a treatment done a month ago, and I couldn't wait to get another one just because I saw so much improvement in my skin quality. And I haven't had the chance to do any other types of treatments. And literally the next day I was in consultations. Nobody really said anything. There was one actually med spa owner who came in for a consult. And she was like, did you do microneedling or something on your forehead? So she was the only one that kind of noticed it. But again, literally next to zero downtime. With darker skin tones, you can notice these little rings for up to maybe 5, 6, 7 days. It will just look like little tiny brown spots. Again, really not bad at all. And you can wear tinted sunscreen over it starting in 48 hours. So great treatment to do kind of on a Friday or Thursday. By Monday, literally you're back to normal. On lighter skin tones, you actually get a little more of just pinkness to the skin. You don't really see as many of the dots with these treatments or the little rings. But again, just really quick turnaround and quick downtime. How's it coming, Veronica?
Very good.
Very
You're
good.
doing so good.
Excellent.
No one needs to hold you down today.
Mm-hmm. Gonna just get my temples? What do you think?
A little bit.
Yeah. Mhm. All done?
All done.
Excellent. Thank you very much.
You did it.
But not bad at all. Let me see if I can show you kind of what my forehead looks like. The quality is not great here, but yeah, that's it. That's it. And the fact that I can handle it, I mean, literally anybody can.
That's awesome. Thank you so much for sharing that with us. That was
For
fantastic.
sure. No, I'm
All right.
excited because I get the results.
Yeah, double whammy.
Double
Awesome.
whammy.
So we have some time now for some Q&A. So I see a couple of questions being popped into the chat now as well. Anybody that has a question they want to pop it in, definitely now is your chance. So let's see, we have a couple here. First question, what would be the frequency to do the 3D miracle, or would it just depend on the situation? And I think she's referring to how often would you need to have this treatment done?
So I hate the answer, it depends. But like I'm gonna give two scenarios, I guess. So if somebody's just like coming in and they want to do kind of just introduce this as part of their skincare routine. So they're not necessarily coming in with like, for me, instance, like I had hyperpigmentation that I wanted to address, some acne scars. And so in that case, I want to do a treatment kind of as soon as possible while maintaining safety, so I get a really good result. So after my 3 treatments, I'd space them out 1 month apart, and then at the end of those treatments, like literally you could put the photos up side by side and you'd be like, wow, those acne scars are gone, that hyperpigmentation is gone. The other scenario is somebody that's like, hey, look, I'm already on a good retinol, I'm on a good skincare routine, I maybe do Botox a couple times a year, but I want to do something a little bit more, be a little bit more proactive about my skin, but I don't really have like a particular skincare concern. In that case, I would probably just spread them out and do it like once per season and do the 3 treatments, like do one in the fall, do one in the winter, do one in the spring, get all that sun damage in the summer, and then rinse and repeat and do it 3 times a year in that way. So you get kind of the best possible result.
Awesome. Let's see, a couple more questions here. Can I do UltraClear and Botox on the same day?
So I don't love combining it on the same day unless we're like kind of skipping that area. So if we're doing Botox kind of in the glabella here or for the 11s, we might just skip that area just because as a surgeon, I always worry about kind of causing a complication. I don't want kind of that Botox moving somewhere where we don't want it. That being said, we could probably do it. I mean, we could even do it the day before or the day afterwards. That would be completely fine. But certainly waiting a week or 2 weeks is fine. In an ideal situation where somebody really has like really deep concentrated lines in the forehead or across the forehead, what I would opt to do is actually do the Botox or Daxify first. Let that settle so you're taking care of the kind of dynamic wrinkles. Wait 2 weeks, let kind of that space of that wrinkle kind of fill in a little bit, but that fine line will still be there. And then do a polish over and rebuild that collagen and really kind of clear up that skin with the UltraClear laser.
Awesome. Let's see, another one coming in here. Can I do UltraClear if I've had a facelift?
Yes, we have a facelift tomorrow, and we're going to be combining her treatment with the UltraClear laser just to kind of help with some old acne scars and really try to resurface the skin, and making it look as best as we possibly can. I combine it with the surgery all the time. It's good as far as kind of like doing a once a year more aggressive treatment maybe to try to kind of preserve the lifespan of that facelift. Or that neck lift, and really try to get the best possible result and longevity out of it.
Awesome. Let's see, for 3D Miracle, how long do I have to stay out of the sun?
I mean, we should be all avoiding the sun kind of as much as possible in general. Take your vitamin D supplements, you'll be fine. But like I mentioned earlier, we have a ton of patients doing treatments in the summer. And so everybody's skincare or skin concern is like, hey, like I can't be out of the sun. Really, you have to be out of the sun for about 7 days. Now, doctors never kind of practice what they're preaching. I'm going golfing this weekend, and it's less than a week, but I'm going to wear a hat. I'm going to be wearing sunscreen at that point. You'll be fine. For the more aggressive lasers where we're really trying to ablate the skin, I mean, being a little bit more diligent, and kind of being really extra cautious during that first week to up to 2 weeks, is best. I like telling people like, wait, isn't like summertime not like the season for laser? But think about the two places in the country where people do the laser the most. It's Miami and it's LA, probably the two sunniest places that are in the country. And these are areas where you just have to be kind of careful. And so you can do this laser literally any time of year. It's more common when, especially the deeper treatments kind of in the fall, winter, spring, but certainly we have a lot of patients doing it in the summertime too. It's just kind of whatever aligns with your schedule.
Awesome, fantastic.
And Holly, I think we do have some questions on Instagram too, if we can
Oh
answer
yeah,
some of those, too.
absolutely.
Yeah, someone asked, is the pain comparable to microneedling?
So somebody asked, is the pain comparable to microneedling? So with microneedling, we put numbing cream on top no matter what. Microneedling alone without any numbing cream is fairly spicy. So I would say that this is less painful, especially the 3D Miracle is less painful than regular microneedling. However, with topical numbing cream, I probably wouldn't have even felt anything at this point with that laser. So it's probably still pretty comparable. Compared to radio frequency microneedling. So I actually did this treatment before we actually purchased this laser, before we kind of signed our big agreement and everything. We did a demo on myself because I don't want my patients to be a guinea pig. I want to experience it myself. But I also treated my mom. And so with her, she's done a lot of different non-surgical treatments over the years with me, kind of the benefits of having a son who's a plastic surgeon. But we've done radio frequency microneedling, we've done Morpheus and things like that. And she said that was a 10 out of 10. This was even using the ultra mode deeper to really kind of help her jawline and neck. This was a 2 out of 10. So both of those treatments used numbing cream, and still like the pain level was pretty minimal. In addition to kind of the numbing cream that we get compounded from a specialty pharmacy for us, we use Pronox too in case you need it. That's 50% nitrous, 50% oxygen. It's just like laughing gas. You can still drive yourself. It's out of your system in 5 minutes, but it really just takes the edge off. So for the people that want kind of the more aggressive treatment and want the more aggressive results, but kind of are a little bit don't have the highest pain tolerance, I guess you can still very well tolerate it. And again, because of how quick those pulses are and how little heat is actually delivered to the skin, you can do this while awake under just topical anesthesia. This has been completely new compared to kind of the CO2 lasers of the past, where literally you had to put people under general because they just couldn't tolerate it, even with the best pain tolerance out there.
Awesome. We have another question is, does it help with broken capillaries?
Does it help with broken capillaries? So it can. So the stubborn blood vessels around the nose in particular, I've seen dramatic improvements literally on the table. With that ultra mode, we can kind of go into those blood vessels, really ablate them, get them to kind of shrivel up and go away. Those do have a tendency to come back. So they can come back and we can treat them again. The broken capillaries kind of in the cheeks also respond, I've seen respond really well to it. The highest caliber, like if you got a big beefy blood vessel, those are the ones that you might not see as big of a response, but really a lot of the lasers out there aren't going to touch those really high caliber blood vessels that are maybe on the nose or elsewhere on the face.
Someone else is asking, does it work for rosacea?
Does it work for rosacea? So kind of in the similar way that it's targeting kind of the vasculature that's causing those broken capillaries and broken blood vessels, it has been shown to improve rosacea. Again, we can dial down the heat, which is a known trigger for rosacea, so that we don't kind of make rosacea worse. But they're working on an indication, a true FDA approval for rosacea as we speak. That should be out hopefully soon as well. But I have seen improvement and have used it on patients that have rosacea without any issues and showing improvement in their rosacea. Yeah. All right.
Awesome. Perfect. I do have one additional question that somebody has asked, and it is all about laser coring and the next webinar. So we do have another webinar scheduled for August 27th at 5 p.m. Everybody that has registered here will make sure that you are also on the list to get the invite. Hopefully we'll be sending those out within another week or two. So definitely stay tuned and we'll make sure that you're invited to that one as well. I hope everybody is texting and calling to go ahead and book their appointments as soon as possible. We're super excited about this laser and really ready to get you all in for a consultation. So thank you, Dr. Sitapara, and thank you everybody for joining. Thanks to the Instagram folks. I think this was absolutely fantastic.
Yep. Thanks again, guys. Yeah, can't wait to see you in the office.